Yes, very good evening. My voice audible? Just one second. Voice audible? Doctor. Yeah. Sorry. A fantastic evening to one and all. Okay, doctor. We will discuss. Yes, very fantastic evening. Ajay Parthasarathi and my other friends. Today we are going to recall INICET Pharmacology May 2024. Before going to that, how do you feel the question, doctor? How will you grade the question? Tough or moderate or mild? What do you feel? Okay, right? We start the session. To start, first question: intermittent injection of teriparatide for osteoporosis causing which of the following side effects? If you find any option missing or any incorrect option, please tell me. I will correct it and modify it, and then we will upload a very good video for you. Okay, right? Intermittent injection of teriparatide for osteoporosis causing which of the following side effects? Okay, moderate. Okay, mild only. Wow, I think pharmacology was easy in this session. Okay, see, teriparatide, a human parathermone analog, one of the osteoblastic drug. It causes adverse effect of osteosarcoma. Answer B. Good. Those commands answer B. Good. This we have discussed even recently in DVT session also. Drug useful in osteoporosis causing osteosarcoma. Parathermone analog like teriparatide discussed. Osteonecrosis of jaw and subtrochanteric fracture of femur. These are important adverse effect of bisphosphonates. Bisphosphonates. So the right answer for this question, option number B. That's the first question. Question number 2. And anybody, if you find any option incorrect, please tell me, doctor. Okay. Right. Question number 2. PCSK9 inhibitor useful in lowering cholesterol. That is pro-protein converting ceftriaxone 9. PCSK9 blocker useful for lowering lipid. It's straight question. We have Evolocumab and alirocumab both are monoclonal antibody targeting PCSK useful for lowering LDL. This also straight question we discussed in our DVT session. PCSK9 blockers names are alirocumab and evolocumab. Ezetimibe, we know it's a Niemann-Pick C1L1 transporter blocker, that is cholesterol absorption inhibitor. Torcetrapib, it's a cholesterol ester transport protein blocker, and lomitapide, it's a microsomal triglyceride transport blocker. So answer is option number B, evolocumab. So two questions, straight question, full mark. Fantastic. Coming to third question. Which of following drug useful in leprosy causing skin pigmentation? It is also state question. Clofazimine, rifampicin, dapsone, ofloxacin. The right answer for the question, option number A, clofazimine. Clofazimine drug causes mainly reddish black skin discoloration, ichthyosis, and discoloration skin, especially reddish black skin discoloration. This we are discussed regularly in our face-to-face class, even back to basic recorded video also we discussing this. So question, our clofazimine causes reddish black discoloration skin. Okay. Rifampicin anti-retrosin discourage secretion like saliva, urine, sweat become discolored. Dapsone, a sulfur derivative causing problem of allergic reaction. Wolfoxin antibiotic. Coming to question number 4. Ready? For treating enterococcal infection in a patient who is allergic to penicillin, which of the following is given? Options are piperacillin, cephalosporin. Can you recollect? Begin somebody mentioned cephalosporin. Can you tell what exactly they given? Which cephalosporin does the option in the option? Any idea? Piperacillin, Astionum, vancomycin. I just want to see the correct option of what they given. This is like just like that they given cephalosporin or any specific drug name they given. Can you please type and tell me? Abhishek Roy, Sonam Koman. Can you please Ajay? Can you tell what option given? Any able to recollect? Anyway, see, when a patient is allergic to penicillin, he will be allergic to all beta-lactam antibiotic that we call cross-antigenicity. So we can't use this and this because ceftriaxone, yeah, very good. Ceftriaxone. I might ceftriaxone. Okay. Anyway, piperacillin and ceftriaxone are beta-lactam antibiotic. They cannot be useful in this case because patient allergy to penicillin. So either answer will be either C or D. But patient was enterococcal. It's a gram-positive infection. Astionum useful for patient who is allergic to penicillin, but effective only for aerobic gram-negative organism. And it's a gram-positive. So the right answer go for option D, vancomycin. Vancomycin. See what Goodman-Gilman says. Astionum, yeah, excellent drug useful for treating patients who are allergic to penicillin, but it's effective only for aerobic gram-negative infection like H. influenza, protease, E. coli, Klebsiella, and good activity against Pseudomonas. Lack of any gram-positive activity. Goodman-Gilman line. So, enterococci, a gram-positive organism where we can't use Astionum. So, better answer go for Vanco. Of course, vancomycin also an alternative for treatment of patient with allergic to penicillin. Okay, so answer option D. Coming to option question number 5. Anti-diabetic drug useful for treating heart failure with a low ejection fraction. Come on, doctor. Whether they given straight like this question or they given history based question. They given straight like this or any history patient with symptoms of heart failure with BP or like the any history or just is anti-diabetic drug useful for treating heart failure with low ejection fraction. Options are dapagliflozin, liraglutide, palmitate, metformin. Can you please tell all the options are correct options? Whether the same options were given in the exam also? Same option? Okay. Anyway, this question deals with anti-diabetic drug useful for heart failure. Of course, we know SGLT2 blocker. Okay. Ejection fraction. Ejection low with the low ejection fraction. Okay, low ejection fraction was given. Okay, good, good. Hmm. Reduced ejection fraction. Okay, low. Okay. Right, and this we know we discuss in our DVT session anti-diabetic drug. I also mentioned very important expected for this year. I mentioned December also in our DVT session. Okay, dapagliflozin, empagliflozin, and sotagliflozin all are useful for treatment of heart failure. So answer is option number A, dapagliflozin. Okay, so I will modify the stem of the question. A diabetic patient with low ejection fraction, for him what the best anti-diabetic? I'll modify the question and then upload it. Okay, and coming to question number 6. And this question came or not, doctor? Somebody in our NEET official Telegram channel, somebody posted this question. Whether this question is there or not, doctor, I just want to confirm. Anti-diabetic drug causing UTI. This question is there or not? If can I please whether the question is there or not? If is there, tell me what are the options given in your question. I don't know. Somebody posted in our Telegram channel this question whether is there or not anti-diabetic drug. Yes, is there. And can I answer? The answer very simple. SGLT2 blocker because this also we discussed in our DVT session. See, a simple also mentioned anti-diabetic causing adverse effect of UTI. SGLT2 blocker we mentioned, but other options I'm not getting. If you able to recollect, can you please tell if there's is was there? Yes, is Arti very good ma is there, but I want option given. Anti-diabetic. Oh, one is pioglitazone. Okay, one is pioglitazone. Other option? Any other option? Any other option? One is pioglitazone. Okay, I will verify the option with the other candidate and then I will post you. Okay. Now, question number 7. Anti-diabetic causing weight loss. Is there? This question is there or not? This question is there or not? Can you tell me yes or no? Anti-diabetic. This time, diabetes shot was very commonly they focus here. That's why in our regular class also, when I start endocrine, my first topic will be always diabetes because diabetes the most, and also my next topic osteoporosis. See, if you see our workbook and our DVT, even regular class, endo main first I start may always diabetes and focus on osteoporosis. Okay. Yeah, I'll come to that. I'll come to that. Okay. Anyway, I'll come. This question, no. This question, no. Okay, leave it, leave it. But we discuss this. Leave it. We discuss this causing weight loss. Okay, so no mean leave it, leave it. Now coming to this question, I think this was there. Okay, oral anti-diabetic drug causing unexplained diarrhea. Any idea? This question is there. I'm sure. Okay, anti-diabetic drug causing diarrhea. Glimepiride, metformin, pioglitazone, dapagliflozin. Yeah, this question, Nila. This question there. Anti-diabetic causing unexplained diarrhea. Glimepiride, metformin, pioglitazone, dapagliflozin. Okay, the right answer metformin. This we discuss regularly in our class. Metformin, one of the most common drugs for type 2 diabetes and one of the most common adverse effect GI toxicity like nausea, diarrhea, indigestion. Okay, this was okay. So answer option number B. Glimepiride causing mainly hypoglycemia. Pioglitazone causing mainly fluid retention. Dapagliflozin lot of things UTI, external genital ulceration, found a gangrene, all these things, Now the answer for the question, metformin causing commonly GI toxicity like indigestion and diarrhea. This was our regular class notes and our workbook notes. So I think straight question. Okay. And of course, is also causing lactic acidosis in the presence of kidney failure, liver failure, cardiorespiratory failure, and in chronic alcoholic patient. Yeah. Next, this was the super question. Anybody? Find out the drug targeting against HER1 receptor. And the options are, yeah, Sweda, thank you, ma. Thank you. All question from your class notes only. Thank you, ma. Go to Pharmacology. Sweda. What? Okay, anyway. Find out drug targeting against HER1 receptor. Okay. Panitumumab, Nesitumab, Pertuzumab, and set, uh, Cetuximab. This is a little bit confusion question. Look here. Come on. Whether the same option given, Lokesh, Sweta, can you please answer? The same options were given. Panitumab, Cetuximab, Pertuzumab, Nasitumab. Whether they given this question or they given multiple response question. Answer option A and B, A, B, C, A, B, C, D. Like the multiple response question or asking simple like this only. What the question? I think it should be a multiple response question. Any idea what was the question? Because panitumab also targeting against EGFR. EGFR also called HER1 receptor. Panitumab targeting against EGFR. Nesitumab also targeting against EGFR. Cetuximab also targeting against EGFR. Panitumumab useful for colorectal cancer, Nesitumumab useful for non-small cell lung cancer, and Cetuximab useful for colorectal. Here, the pertusumab is only one targeting against HER2. HER2, okay. No multiple option. Wow, if no multiple option mean it's a very, very danger question because Goodman-Gilman says EGFR is also called HER1 receptor. So Goodman-Gilman line. That means this all are targeting against HER1 receptor. Okay, so this question you can argue with the examiner. You can go for this scrutiny because A, B, D all are acting against HER1. The only one answer here is pertusumab targeted here too. So it should be a multiple response question only. Anyway, the answer is A, B, D. Okay. True statement about Voriconazole. This also very, very confusing question. Come on, come on, come on. Okay. Wait. In an diarrhea, in this diarrhea case, one option was sitagliptin. Okay, one option sitagliptin. Somebody telling, I will modify. One option sitagliptin. Anyway, the answer is metformin. Sitagliptin. Gliptin causing mainly adverse effect of upper respiratory infection. So that's not answer. Answer will be option by metformin only. Coming to this question, look here. Ready? True statement about Voriconazole. Just to look at the option whether the same option are given or any modification are given. Please answer. Yes, ma. Sairam. EGFR also called as HER1 receptor. HER1 receptor. Okay. So with the false statement. Okay. Okay. False statement. False statement. Okay. False statement. Not true. Okay. What the answer? False statement was asked. Okay. Take look at the option. Options are right regarding Voriconazole. Find out the false statement. Options are right. False was okay, ma. Okay, ma. Now just answer. Tell me. The same option given. Take an empty stomach. Not given the pyrazinamide. Needs therapeutic drug monitoring. Loading dose given. The same option was given. Any answer C? Okay. Swetha telling answer C. Okay. But actually, when you refer Goodman Gilman, he says Voriconazole absorption will be interfered with a high fatty meal. So they should be taken either 1 hour before or 1 hour after meals. That means they should take an empty stomach. So it's true statement. So true statement. Okay. And not given with the pyrazinamide. That is nothing relevant. Actually, it may have some interaction. Voriconazole undergo metabolism by CYP enzyme. So some interaction can be there. So can accept this. Okay. And it has a large volume of distribution. So it needs loading dose. That's all true. False statement, you can say A mean that's a problem because Goodman Gilman says Voriconazole TDM should be measured. It should be around 1 to 5 milligram per liter. Monitoring is particularly important for children who have unpredictable plasma level of voriconazole. So voriconazole also needs monitoring. The words given Goodman Gilman. So that's why asking whether the same option given or not. Okay, good evening. There were 4 to 5 questions straight from your predicted series. Thank you. Very good, ma. Very good. Thank you very much for your good feedback. Good, fantastic. Okay. This is again confusion, doctor. I want to know whether the same option given or some other options are given. Because among this loading dose given, because I definitely know for treatment of infection, first they give IV loading dose, followed by maintenance dose and they give an empty stomach. Okay, false. This also true only. Okay, so false type may mean confusion. Anyway, I'll verify the option and tell you later because Goodman Gilman says it needs monitoring. The level should be around 1 to 5 milligram per liter. Monitoring particularly important for children who are very unpredictable. Okay, they're on empty stomach. Take an empty stomach. Okay, this can be okay, that can be answer A. Okay, because fatty meal only enter absorption, nothing others. Okay, next, this question, diuretic and site of action matching, this I told in predictor series, definitely one question based on diuretic site of action. Now I just want to know what was the option given, whether the same drug name given or something else given. Can you answer? Voriconazole after food, better absorption. Okay, okay, ma, good. So answer A. Now diuretic name. Come on. Mannitol, furosemide, spironolactone. The same option given or some other options are given? Can you please answer? Whether same option given? Thiazide given. Oh, thiazide is also given. Thiazide. What about mannitol? Carbonic. Same. Somebody same. Carbonic. Okay. Carbonic like acetozolamide was there. Acetozolamide was there. Okay. Now, that means mannitol is not there. Whether mannitol is there or not in this question, mannitol is there or not. Just answer yes or no. Mannitol option was given or not. I just want only one thing. Mannitol option was given or not. Okay, carbon. Okay, mannitol is there. Okay, carbon inhibitor osmolality. Okay, that means I'll tell you. Okay, anyway, I just meant. See, carbonic anhydrase enzyme inhibitor acting on PCT. Okay, and then furosemide, a loop diuretic acting on thick ascending limb of loop Henley. Okay, and thiazides acting on distal convolutional. Potassium sparing diuretic acting on collecting ducts. Mannitol acting on PCT and descending limb of Henley. Okay, so multiple right answer. Okay, multiple answer means this answer. Carbonic anhydrase enzyme blocker acting on PCT. Furosemide acting on thick ascending limb of Henley. Thiazide acting on DCT. Potash diuretic acting on collecting ducts, and mannitol acting on PCT and descending limbo loop Henley. So I will modify the question. It's a multiple response question. Okay, I'll modify multiple response question. Next question. Ah, drugs useful for treatment of cyanide poisoning. I think state question. This also I mentioned pre-thesis expected. Bitter almond water, cyanide poisoning expected. Okay, drug useful for cyanide poisoning. Come on, it is also multiple response question or what is the question pattern was there? Come on, drugs useful in cyanide poisoning. What is the option and what is the response they given? Yeah, Sweda, medicine told I understand. Mannitol osmolality acting on any portion, but most commonly acting on PCT and descending limbo loop Henlima. Maximally acting anywhere, but maximally acting on PCT and descending limbo loop Henley. Okay. Now, right. Now this question, multiple pattern. Okay. So multiple pattern question. Okay, very good. That means the answer for the question is sodium nitrite, amyl nitrite, and sodium thiosulfate. They are useful. A, B, C. Very good. Sonam Kumari. Very good. See, for treatment the cyanide poisoning, we can go for antidote kid. Cyanide kid is there where amyl nitrate, sodium nitrate, and sodium thiosulfate. Of course, we also have one thing called hydroxychloroquine B12. That is also can be useful for treating this poisoning. Okay, so answer A, B, C. Actually, we discuss in our when we discussing CVS class in regular class nitrites. When I talk about nitrite, one of the non-cardiac use nitrate useful for treatment of cyanide poisoning. For example, cyanide uh, uh, like uh, this one, they're going to chelate. They're going to chelate the cytochrome oxidase enzyme that will causing cell or anoxia cell death. To prevent this, we are using sodium nitrite or amyl nitrite. They're going to produce into methemoglobin, thereby all the cyanide attracted towards methemoglobin, and they're going to form cyan methemoglobin. To excrete this drug, we are adding with the thiosulfate. That also useful. So the kit having sodium nitrite, amyl nitrate, and thiosulfate. Okay, so the answer for the question, if the options are given sodium nitrite, amyl nitrate, thiosulfate. If it is there, these are the answer. A, C, and C only was correct. Okay, okay. A and C only. Okay. A, B, C, all are right answer. Gelatin has no role, no role. Only nitrites has no role. Okay. Next question. I think very straight question. A male with a fever, cough, with a white tenacious sputum, true statement. Having fever, cough, and tenacious sputum. For this patient, true statement. Ready? Dextromethorphan to suppress cough. Both dextromethorphan with the bromhexin to thin out the sputum, codeine. See, codeine, a cough suppressant called anti-tussive agent, useful only for dry cough, only for dry cough. Dextromethorphan, a NMDA blocker having opioid action, also acting on central. It is also cough suppressant called antitussive. Antitussives are useful only for dry cough. Dry cough. So it is ruled out. It is ruled out. If it is ruled out, this is also ruled out. So for thick tension sputum, we need some mucolytic. The mucolytic should be bromohexin to thin out the sputum. Answer is option number C. Okay. Bromhexin. Yeah, good. Sairam, good, ma, good. Bromhexin to thin out the sputum. That's the right answer. Good. Now, a 30-year-old female with chronic hypertension and headache, which of following is not useful in postpartum hemorrhage? This question was there or not? Can you please tell me? This question is there or not? Dr. Sweda, Dr. RK, Dr. MS, can you please tell me? This question was there. A 30-year-old female. Why not B for this question? Yeah. Hey, why not B mean dextromethorphan, a cough suppression, cough suppression. Patient with tenacious sputum for this infection, infective sputum. For infection cases, we should not go for dry cough. Don't go for antitussive. Antitussive. So that's why this ruled out. That's why go for option number C. So whenever dextromethorphan given is antitussive, useful only for dry cough, not for infective cough. Okay. That's why asking Dr. Sweda and telling dextromethorphan, a drug useful acting on centrally, it's a dry cough, dry only for dry cough, not for this case. Okay. So best is go for bromhexin. Okay, Sweda. Because patient was given fever with the cough and the tenacious infection with the tenacious sputum. So infected case we should not go for antitussive. Okay. Now a 30-year-old female with chronic hypertension and headache, which are following not useful for in the postpartum hemorrhage. The answer should be methyl ergometrin because patient having severe chronic hypertension. Ergometrin a vasoconstrictor further worsen the BP. So definitely it's answer. Okay. Just kindly check the options are same option or different option. That's also please check. That way I can modify the question. I can upload in our e-medicos all this. Okay. Answer C. Very good, ma. Very good. Ah, anticoagulation or coagulation monitoring is needed for what? Anticoagulation, which needs monitoring. Kindly check the options whether the same option given or not. Enoxaparin, dabigatran, leprosy, fondapagnus. First, tell me whether the same option were given or any modification. Same option. Okay, okay, Abhishek, right? Now, if the same option mean, see, in our regular class we discuss whenever we discussing anticoagulation, we discuss how to monitor. For example, heparin. Heparin mean unfractioned heparin needs monitoring by APTT. Okay, APTT and LMWH. Usually they don't need no need to monitor because a very safer drug no need to monitor but they undergo renal route of excretion. So in kidney failure they need monitoring by assessing anti-factor 10A level. Okay. So usually for LMWH we don't need monitoring, but in kidney failure, Sweta, like you people posted me. Okay, so a lot of people posted me the same option. That's why, because I have people like you, Sweta. That's why I'm getting same options. Okay, LMWH no need monitor because safer drug. But in case of kidney failure, it need monitoring by assessing anti-factor 10A. And dabigatran, a oral drug usually does not need monitoring, but warfarin oral drug that also need monitoring. Leprodin definitely needs monitoring, APTT. And fondapagnus no need monitoring. What Goodman-Gilman says, look here. Usually for LMWH, we don't go for monitoring, but in case of kidney failure patient, they need monitoring by anti-factor 10A. And dabigatran, no need for monitoring. And then leprodin needs monitoring, assessing APTT level and creatinine because this also goes to the kidney. And fondapagnus, no need to monitor. If it is single response question, go for answer C, leprodin. Multiple response question mean go for A and C. What is your opinion? Whether the given single response question or single option, single option mean go for option C, ma'am. Because comparing to this, it is unsafe. It's unsafe, so definitely needs monitoring APGT. So single response question mean go for option C, leprodin. That's the best answer. But according to Goodman Gilman, enoxaparin LMWH that's also rarely needs monitoring. So answer for this question option C. Now, next, cannabidiol is not given in dash. See, cannabidiol having anti-epileptic action. Now they're trying for treatment epilepsy. Now look here, Dravet syndrome, Rett syndrome, tuberous sclerosis complex, Lennox-Gastaut syndrome. See, cannabidiol useful for Dravet syndrome, useful for infantile spasm with the tuberculosis, also Lennox-Gastaut syndrome. So, useful for A, C, and D. These are right answer. For Rett syndrome, we have one trofinide. Trofinide I discussed in previous. Anyway, note cannabidiol useful for Dravet syndrome, Lennox-Gastaut syndrome, as well as tuberous sclerosis complex. Okay, whereas for Rett syndrome, we discuss in previous series trofinetide. It's only one drug got approved for Rett syndrome, trofinetide. Okay, so for this question, I think it's a multiple response question. For this question, you please go through answer A, C, and D. That is question number 16. Coming to 17, ready? I think very easy, straight question. Which of following is useful for quick reversal of Vicronium? Vicronium, one of the non-dipole SMR. For this, what is the best answer? Come on, just kindly check the options or same option in the exam. Can I please go through? Yes, this question reference from article from journal because there are a lot of studies are going with the drop with the cannabidiol. For this, we have a lot of I corrected PubMed journal. From that, I got the answer. Okay, now look at this. Ah, which of following useful in quick reversal acronym? Yeah, good. All are answered nicely. Right? It is Sukhamadex. This also we covered in a regular class. No. So normally for reversal of for muscle action, we go for neostigmine with the atropine or with the glycopyrrolates. Whereas Sukhamadex is a special drug useful for reversal of vecronium and droconium. This we be discussing our regular class. So vecronium and droconium can be rapidly reversed by Sukhamadex. This was a regular class notes. Okay. Next. This is again confusion. Can you please help me? Suicidal inhibition seen with the dash. Whether this question is there, if there mean, what are the options given? Can you please tell me? Suicidal inhibition seen with spironolactone, ritonavir, benzbromarone, and one more option I've not got. Whether can you please tell me whether the question was there or not? Suicidal inhibition. Abhishek, right? Sir, lucky to have mentor like you or king like Kohli. Aye. Anyway, one option estradiol. Estradiol. Okay. That is ethyl estradiol. Okay. Is one option. Uh, we see suicidal inhibition mean those drug inhibiting any enzyme irreversible inhibition, or will call hit and run action. Okay, it's called as suicidal. Okay, yes, same question was there. What the answer you made? If same question there mean what is the answer you made in the exam? Huh? Suicidal inhibition mean those drug inhibiting enzyme irreversibly are having short half-life but having longer duration action. What answer you made? Multiple response question. Wow, my God. In this multiple response question, it's a multiple response question. This I think it's tough question, doctor, because spiral suicide blocker mean we have a lot of example like clavulanic acid, beta lactamase enzyme blocker, or we have something called uh, uh, omeprazole, pantoprazole blocking irreversibly H plus K plus ATPase like this. But this question, I just give me time. I'll verify and upload the answer. Okay, whether I have to check. First, tell me whether they given single response question or they given multiple response question. Please tell me. And if the same option mean, I will verify and tell you later. So it's a confusion because I need reference. I don't find any reference. I will find out the reference and tell you later. Okay, it's a confusion. And I think one state question, most important estrogen was there. Any idea? This question is there. If there mean answer is estradiol is the most potent. Estriol is the weakest. This, yeah, it's a multi. Okay, It's a multi button question. I will verify and tell you answer later on, doctor. Just give me time, doctor. Okay, with the reference, I will tell you. Okay, right now, most potent estrogen. If there is if Yeah, Israel. Yes, very good, Israel. And what are the option given? Can you able to recite the options? One estradiol, other must be estriol. What are the options C and D? Any idea? So here the answer is estradiol. Can you able to recall the other options? Option E1, E2, E3. Uh, Estron. One is estron. Okay. One more thing, conjugated estrogen. Okay, doctor. Thank you. So answer is estradiol is the most potent estrogen. Okay. Good. Thank you. Next, inhalable. Ah, inhaled nitric oxide useful in dash. Whether this question came or not, whether this question was there or not. Inhalable nitric oxide useful for dash. This question is there or not? Yes, yes mean useful for what? Useful for pulmonary artery hypertension. Okay. Now, what are the other option given? Can you able tell? Can you able to recall? Inhaled nitric oxide useful for managing. What are other options? The right answer, pulmonary artery hypertension. Your David notes are very, very useful. Thank you, doctor. Thank you very much. And what are the other options? Can acute, okay, acute unstable angina. Okay, other options about okay angina persistent. Okay, persistent pulmonary condition. Okay, non-STMI primary erectile dysfunction ED. Okay. Answer persistent pulmonary hypertension. Next, whether this question is there or not, drug reducing mortality in CKD patient. Whether this question is there or not, drugs reducing mortality in CKD. This question is there or not? I think somebody posted one option they give ARB, one option Finnian. Whether this was yeah ED. Okay, this answer persistent pulmonary hypertension. Okay, coming next question. Yeah, it's there. No? Expect type, except type. What is the option given? Except drug reducing mortality CKD. Is this mean what are the options given? Can you please answer? What are the options are given? Phenylalanine. Phenylalanine is a wonderful drug, a selective mineralocorticoid receptor antagonist useful for preventing mortality. Other option AGLT2 blocker. One more option. One more option. Thiazides. Thiazides. Chlorothiazide. Okay. Last one. Thiazide. Okay. Drug reducing mortality in CKD. That is actually this we discuss in our DVD also in CKD patient to prevent kidney to prevent heart failure to prevent mortality we have latest drug called phenylalanine. Okay. Now, I think there's a question based on competitive and non-competitive answer, a graph-based question. Whether it's a graph-based question or any statement-based question, doctor. HGLT blocker was not there. HGLT was the answer. HGLT's answer was no. I just want to know which. Yeah, I told, but I just want to know correct options. Uh, patient with Drug not useful CKD. Oh, drug not useful. Drug not useful in CKD. That means answer thiazide. Thiazides are not effective in the presence of kidney failure. For thiazide to act, the patient should have proper kidney function, except metalazone. Okay, thiazide not effective, which is not useful mean thiazide. Not useful mean thiazide. Go for thiazide. Okay, right. Graph based question. Anyway, in the graph main in competition. See, imagine it's a dose response curve. In competitive, the dose response curve shifted parallel to our rights. Right. That means efficacy same, potency get decreased. In competition, efficacy that is Vmax same, potency that is Km get decrease. In non-competition, the curve become downward. That means efficacy Vmax decreases, whereas potency Km same. So this under common question. Okay, we log dose curve. Okay, it's a biochemistry question. Leave it. So anyway, biochemistry mean leave it. Okay, that's a curve based question. Okay, now somebody posted this question. Rodenticide white powder injection somebody given. I don't understand what is this. Whether it's a toxicology from forensic medicine or from pharmacology, I don't know. What is the question? Crossing was non-crossing biochemistry. Okay, leave it ma. So coming to my question, rodenticide white powder ingestion. This somebody posted in our e-medicals group. I don't understand whether pharmacology question or FM question. They given something. What is this? What is the full question? Is not asked. Okay, leave it. And any question from alcohol withdrawal related question? Any question from alcohol withdrawal related question? Forensic. Okay, forensic FMT. And any question alcohol withdrawal related pharmacology question? Identify. Okay. Rodenticide. Okay, what was the toxin? Hypokalemia or toxin? Okay. Rodenticide causing hypokalemia. Okay, that was the FMT question, not pharmacology. Okay, good ma. Good. FMT question. Leave it. Any last question? Uh, can you just post me what was the question? Alcohol withdrawal later question. Some questions there, but I don't know exact stem and options. Somebody told this was discussed in medicine. Thanks a lot. Okay, I think all the question I whatever I collected from students I discussed. If any question left out, you please post me, doctor, in your group, or else you just post your question through form at gmail.com. If any question missed main, you please post it, or you please post in our DAMS Facebook, DAMS Telegram channel. Okay, and once you put the question, inform me. I'll go through. Okay, so use our DAMS Telegram channel, post your question and inform me. I will respond to you. And within 1 or 2 days, we will collect all the correct question with the option. Uh, I covered totally about 21 question, Dr. Sweda. Totally, I covered today 21 question, but I don't know what exactly extra question. I don't know. Most probably 25 to 27 something, but I covered nitric was used in treatment all except okay. I'll modify nitric was used in treatment all except useful in okay nitric oxide mainly useful for pulmonary hypertension. Anyway, I will check the question and tell you later. Okay. So most probably around 26 to 27 question, but I covered today about 21 to 22 question. Most of the question you answered nicely, and most of the question from our regular class notes and DVT and workbook. So I think you are going to get a very good bright future. Okay, and thank you for your prediction. Thank you. Thank you very much. Thank you very much. It's all God bless us. Okay, and wish you all the same. May God bless you. All the very best. Thank you for the opportunity. Thank you, ma. Thank you. Thank you.